Welcome again, everyone. So I'll quickly run through the webinar action points again. So this webinar is essentially looking at the menstrual product taxes and trying to understand the action and impact around period tax campaigns, particularly in the context of LMICs. The agenda for today essentially is going to be looking at, so agenda for the next 1.5 hours is going to be, we'll have Karo Omu from the Sanitary Aid Initiative, who will be setting the scene for the discussions. We have Dr. Laura Russo from the University of Wits, who will present her work on the economic assessment of menstrual hygiene product tax cuts. We have Susan Fox from Global Health Visions, who will share the story of menstrual hygiene product tax advocacy across 4 countries and also lead a virtual roundtable with period tax activists from Bangladesh, Nigeria, and South Africa. And this will be followed by the launch of the period tax website by Ina Yurga from Wash United. And then, if time permits, we will have Q&A from the audience and closing remarks. I would again request everyone joining in today to introduce themselves in the chat box and also pose any questions for speakers in the chat box as the discussions are going on. And time permitting, we will take up some of these questions at the end of the sessions. I'll now invite our first speaker for setting the context. Karo Omu is the founder of Sanitary Aid Initiative, Nigeria, and she currently focuses on working with community members to improve the quality of lives of women and children. She is specifically committed to working on the accessibility of menstrual hygiene products to women and girls from impoverished communities and internally displaced people's camps. So Karo, please take it away.
Hello, Tanya. Thank you so much for that brilliant introduction and for, everything you've said so far. Thank you for having me here today. I just wanted to start, to set the scene so we understand why we are here today. We know why we're here, but just context for the conversation of today. And I would like to start with the story of Halima, a 15-year-old girl from Nigeria who had used rags all through her periods until we met her. When she first got her period and she found out that she would need to use pads, she didn't bother speaking to her parents about it because she just felt she couldn't afford it. Pads cost about 600 naira, which is about $1.30, and she didn't bother. Girls like Halima, Nkiru, so many other Nigerian girls are part of over 6 million girls in Nigeria who are affected by period poverty. Period poverty is commonly defined as lack of access or affordability of period products. One of the things we found out through all of this is that since there are 6 million girls, over 6 million girls in Nigeria affected by period poverty, we had to step in, and that's what led to us forming Sanitary Aid Initiative. What Sanitary Aid Initiative, like Tanya said, it does is to provide pads for impoverished girls and girls from low income and middle income homes and women as well. The UNICEF says that about 1 in 10 African girls misses school because of lack of access to period products. And Nigeria, like many other countries represented here today, has placed heavy tax on pads. Currently, we say that locally made pads are not taxed, but a lot of people depend on internationally made tax, and the products have continued to skyrocket in prices. So it is because of all of these actions and all of these activities that has led to the increase in tax advocacy, which is the advocacy to make sure that periods are tax exempt. Knowing, of course, that period products should not be classed as luxury products because periods are a necessity, and it's not a luxury. You don't have to be rich to have a period. Your period doesn't know how much you make. It's going to come every month likely. This is one of the reasons why governments around the world have begun to look into and listen to what activists have been talking about as regards period tax and tax on products. And different governments have committed to end period poverty by 2030. This is such a huge goal, and this goal cannot be achieved without conversations like this one that we are having today. So it is because of schoolgirls, young women around the world who are coming together to say, this is a sexist law. These taxes are basically inhumane, and these taxes are not right. So how do we change that? So it is because of these girls like Halima, girls like Nkiru, girls who are 13, 14, 15, young women who are 21, 30, all women. It's because of those women that we are here today. For women from Nigeria, from South Africa, from Bangladesh, from countries around the world, we want to hear their stories. We want to hear the impact. We want to talk about the advocacy. We want to know the best way to advocate. We want to represent them here today. And that is why you'll be hearing from other amazing women who are doing the work. So thank you, and I hope you enjoy. I hope you learn something, and I hope that you remember girls like Halima. Thank you.
Thank you so much, Caro. That really laid out nicely why we need menstrual equity campaigns in the first place, and that the issue of availability and affordability in LMICs is far from addressed. Next, we have Dr. Laura Russo. Laura is a senior lecturer in economics at the School of Economics and Finance, University of Wits. Prior to joining WITS, she was a senior research officer at the Economics of Tobacco Control Project and the project manager of the WHO FCTC Knowledge Hub on Tobacco Control based at the University of Cape Town. She holds a PhD in economics from Stellenbosch University, South Africa. Laura's research interests include demand-side and behavioral factors related to health outcomes and health-seeking behavior. And she has previously worked on projects addressing maternal and neonatal health outcomes, focusing specifically on improving healthcare utilization. Laura will be presenting the economic assessment of menstrual hygiene product tax cuts, a work funded by the Bill and Melinda Gates Foundation. Laura, please take it away.
Okay, thank you, Tanya. Right, so like Tanya mentioned, I'm going to be presenting on the research I've been doing with my colleague Hannah Ross from the University of Cape Town, looking at an economic assessment of menstrual hygiene product tax cuts, funded by the Bill and Melinda Gates Foundation. So really what we looked at is whether or not menstrual hygiene product tax cuts really had an impact on the retail prices of these products and affordability. And we did this by looking at 4 countries which had experienced a tax cut in some shape or form. And so although they all had some form of tax cut, the policies in these countries were really different, and so were the countries' experiences. So for instance, in Bangladesh, we saw a temporary tax removal of VAT on menstrual hygiene, on raw imported materials used to produce menstrual hygiene products in an attempt to stimulate local production. In Kenya, we see probably the most extensive removal of taxes. So in Kenya, they've started removing the taxes on menstrual hygiene products in 2004. And by 2016, they had removed most applicable taxes, including the taxes on raw and imported material, raw and imported final products, and domestically produced products. Nigeria is the country that most recently experienced a tax cut, and in February 2020, they exempted locally manufactured menstrual hygiene products from VAT. And then finally in South Africa, there was a removal of value-added taxes on sanitary pads in April 2019, but tampons and menstrual cups still remain taxed. Thanks. Next slide, please. So to address this question of affordability, we built a set of economic tools. So these tools are all available and I think have been distributed to you. And if not, please just contact us directly to distribute the final report. Basically, they're freely available, very accessible and easy to understand, and described in our report, and we substantiated these tools using interviews with stakeholders and literature. So some of the tools that are available is an affordability index, which is used to calculate the price of sanitary pads relative to income, and it allows us to compare the affordability of sanitary pads globally. We also built a market concentration index, which measures the level of market competition in sanitary pads. And then we also have a tax simulation model, which predicts the impact of VAT policies on various outcomes. So we look at the impact of a removal of value-added taxes on menstrual products, on the use of these products, government revenue, and various other equity outcomes. Right, next slide, please. Thanks. And so what we broadly found was, unfortunately, that removing value-added taxes is not always sufficient to result in a drop in the retail prices of menstrual hygiene products and improve affordability. There are various political and economic barriers that stop this from happening, which include complex tax systems and corporate interests, which I'll be discussing more in detail in the rest of this presentation. But that being said, these tax campaigns are still incredibly valuable in their own right, in the sense that they get conversations going, they address a lot of the stigma that still surrounds menstrual hygiene management, and they really address, and to that extent, address matters of gender equality. And Sue, who will be presenting later, will be addressing a lot of these, we'll be talking about a lot of these things that the campaigns have done. And then also just a caveat that I want to point out is the fact that there are really major data gaps when it comes to exploring the topic of affordability in menstrual hygiene products and the impact of these tax cuts. There really isn't a lot of data being collected on prices and products being used. And it's something, and so there's a lot of questions that sort of remain unanswered empirically. Okay, thanks. Next slide, please. So, like I mentioned before, there's been this global move to use the removal of value-added taxes in an attempt to make menstrual hygiene products more affordable. But what we still observe is that, especially in low and middle income countries, menstrual hygiene products still remain incredibly unaffordable. So, using our affordability index, we show that Kenya, for instance, as you can see on the right over here, a country that has actually removed various facets of taxing, still has some of the least affordable sanitary pads globally. In comparison, South Africa, a country that only recently started removing taxes, has sanitary pads that are affordable in have affordability levels that are comparable to various high-income countries, as you can see from the blue bars on the left. But we also can, like I'm going to show, South Africa has a much more competitive market. So there's a lot of factors at play causing these products to still be less affordable. Okay, next slide, please. So one of the reasons why products remain unaffordable, or the reason that VAT removals don't necessarily lead to a drop in retail price, is the fact that private sector still plays a very dominant role in setting the retail price. So we know that government sets the tax policy, but it's essentially up to the private sector and companies to set the retail price. And what we often observe is that in highly uncompetitive markets, rather than using these tax cuts and dropping retail prices, companies absorb these tax cuts into their profit margin and keep retail prices at the same level. And like I mentioned, this is particularly true in countries where we see as uncompetitive markets. So to this end, we created this market concentration index, which we use to measure the level of competition. And we set a threshold of 25, the index value of 25 and higher, to classify a country as a market as non-competitive. And in the countries we studied, it was only in South Africa that we saw a moderately competitive market. Unfortunately, we didn't have data for Nigeria, so that's the data limitation that we experience. And this index is also linked to affordability. So in countries where we see a non-competitive market, we see products are more unaffordable. And so it's really crucial to be aware of the role of corporate interests in shaping these VAT removal policies, because they are incentivized to have taxes removed, because this would potentially increase their profit margin. So, for instance, in one of the countries we studied, we saw that it was the tax policy was shaped in such a way that only one domestic production company was able to get the tax cut. And for above that, they also encouraged a supplementary tax to be placed on imported material. And so essentially, this actually just leads to a more uncompetitive market because you only have one key market player who draws a lot of advantage from these tax cuts. And yeah, so a more uncompetitive market means necessarily higher retail prices. Next slide, please. So apart from the role of corporate interest, another factor that could contribute to the fact that these tax policies aren't effective is the complex nature of pricing and taxing menstrual hygiene products. So various components of the price of a menstrual hygiene product can be taxed. This could include the raw material, but also the final product. Apart from that, there's also a distinction between VAT exemption and VAT zero rating. When a product is VAT zero, the final product is VAT zero rated, and you remove the VAT, that means that the companies can usually claim back the input taxes. This is not true when a product is VAT exempted, which means that we often find with VAT exemption that it has almost no impact on the retail price. So we use this bar. So if you look at the bar on the left, that's a decomposition of the price of a sanitary pad in Bangladesh. And we just use it to show how complex the tax structure of a sanitary pad is. So you can see it's made out of the different components. We have the retail margin, the wholesale margin, and then the top two bars is value-added taxes and also the tax on imported material. That's the second bluish bar, second from the top on the bar on the left. Component, yeah. So that's 8.2%. So in the case of Bangladesh, they removed the tax on raw imported material, so that's only 8.2% of the final product of component of the price of a sanitary pad. Of that 8.2%, only 60% was actually removed, and so at the end of the day, you're ending up with removing really a very small part of the actual price of the sanitary pad, and so it's not surprising that the impact on retail prices could be potentially very small. Next slide, please. And so the other thing that I really just want to point out, and I'm sure that anybody who's worked in this field has come across this, is the fact that these policies are very rarely monitored and evaluated. It's very rare that after the policy has been implemented, that there is a follow-up to see whether or not the change in the tax policy has resulted in a change in retail prices. And so to this end, we built this tax simulation tool, which is basically just an Excel file with different formulas, and you can use it to predict various scenarios, how a change in tax policy could result in like a change in products being bought, government revenue, the retail price, and then different equity measures within the country. So it's an Excel tool, it's a model that you can use to populate. And so don't really pay too much attention to these results. This is just the preliminary results from our calculation for South Africa to show what this tool was able to do. At this moment, it's still, I would say, it hasn't been validated, the tool, because we were constrained by traveling during COVID. And so the ideal would be to validate these models with country policymakers. Okay, thanks. Next slide, please. So to summarize, there are many factors affecting the impact of value-added tax removals on the prices and affordability of menstrual hygiene products, including complex tax structure, competition, and corporate interests. And in the meantime, the products remain unaffordable to such a large part of the world. And so a way forward would be to, take a step back and to think, is this really the most effective policy? Are there potentially other policies such as targeted subsidies that might be more effective and that we should actually be promoting? But to address these questions, one of the first steps would be to get more data and to do more research on this and to establish what is best practice. Next step, please. Next slide, please. And so our recommendations for countries are to systematically evaluate the impact of tax removals and promote data collection, to promote local manufacturing of menstrual hygiene products and to incentivize competition. Tax policy proposals needs to be explicit about the target rationale and to provide, there needs to be an impact analysis of these policies. And also to consider targeted subsidies to support free or affordable distribution of menstrual hygiene products. So one option would be the use of a voucher system so that people could have subsidied access to some of these products at different outlets. Okay, next slide. I think that's it. Okay, so thank you very much and thanks for listening. I've included the contact details of myself and my colleague, Hannah Ross, if you have any specific follow-up questions. But thank you.
Thank you so much, Laura. Thanks for that. Those are some great insights. And definitely, I think that's a great snapshot of what the period tax campaigns should really look at the structure, the tax structure and the market structures before actually deciding on what direction to take, or even look at alternative economic tools, like you mentioned, like targeted subsidies. Particularly interesting to me was how highly variable prices seem to be in LMICs compared to developed countries, and how they are sticky downwards essentially because of the oligopolistic nature of those markets. But coming to the next objective that we are also trying to tackle of period tax campaigns, which is the gender justice issue. We have Susan Fox next, who is going to be presenting on advocacy stories from 4 different regions. And so Susan Fox has worked in the global health space in various capacities for almost 20 years. Hi, Susan, and is currently a senior consultant with Global Health Visions, which is a women-owned and operated consulting firm based out of New York. Susan also recently authored a series of case studies on country-level menstrual hygiene product tax advocacy campaigns, which is now something that she'll be presenting, and also moderating a virtual panel discussion. So all yours, Susan.
Thanks so much, Tanya. So it's an absolute honor to be here with you today to share some highlights of a series of case studies that I've been working on for the past year, looking at tax advocacy campaigns in 4 countries that were shaped by the experiences of about 50 people in 4 countries. We are fortunate to be joined by 3 experts from 3 of these countries today on our panel discussion in just a few minutes. But I'd just like to quickly provide a snapshot of the campaigns in these 3 countries to set the scene. So in Bangladesh, as Laura explained, there was a sector-wide advocacy campaign by WASH and other partners, after which the government issued a 2-year removal of tax on imported raw materials used to produce sanitary napkins in June 2019. Due to the nature of the exemption and due to the market itself, just one company is benefiting from the exemption, but this VAT removal was a strong statement by government that they were prioritizing this issue. It generated visibility and support on menstrual hygiene affordability, and building on this win, stakeholders are already advancing further progress. In Nigeria, with a local market dominated by expensive imported products, the country removed VAT on locally manufactured sanitary products in February of this year to promote local industry. This was a first attempt on menstrual hygiene product tax relief, driven by Nigerian advocates, influencers, and local organizations, some of whom I know are on this call today, who utilized traditional and social media to raise the issue with public and decision makers. This ultimately set the stage for other policy actions and raised public awareness and countered persistent stigma and taboos. So finally, in South Africa, following widespread pushback on an increased rate of VAT, government established a panel to consider and recommend goods to be zero rated. Researchers, grassroots campaigners, the media, and beyond all played a key role in influencing the panel's recommendations and the government's final decision to zero rate sanitary pads in 2019, which was supplemented with a commitment to provide free distribution to schools in low-income areas. So what do we learn about this work? Next slide, please. So yes, as Laura said, there were definitely limitations in terms of showing a positive impact on affordability, because there were often other policies, loopholes standing in the way. But there was clear value out of this work, which stood out in each country and is absolutely critical to recognize. So here on the right, you'll see my scale. First, there were the tax relief measures themselves, which are critical to identify. The governments were stepping up to support this work, despite the implications on lost revenue, which is really important to recognize. There were additional subsequent policy level actions that followed these tax relief wins, and momentum within government to move forward on the issue of affordability. Finally, but equally important, there were non-economic broader benefits of these campaigns, so countering stigma and serving as an entry point for addressing related systemic issues. So in conclusion, on my next slide, I would argue that while economic impact may have been minimal in these countries that we examined, product tax advocacy had a clear value add in advancing menstrual hygiene management, particularly from a gender justice perspective. However, it should also be recognized that tax relief is not a silver bullet, and it shouldn't be addressed as such. It should be part of a holistic approach to menstrual hygiene management. So next slide, I would like to introduce you to a powerhouse of panelists that we're going to be speaking to about some of these issues today. And if the panelists could please turn on your videos. You've already met Caro, and you know how amazing she is. So Caro, I think, will be on here momentarily. Let me introduce you next to Kirsten Pearson, who is a project specialist with Corruption Watch and a member of the Budget Justice Coalition. The Budget Justice Coalition is a group of about 20 progressive civil society organizations who acknowledge that work to ensure substantive equality in our society is not possible without active engagement with and transformation of the budget. So welcome, Kirsten. And finally, we have Faratiba Rahat Khan, who is a development professional with experience backed up by private sector interventions and development sector working realities and challenges. Currently, Farah serves as the team leader for the RMG Inclusive Business Programs of SNB, where she's facilitating interventions in garment factories on worker health and well-being, following a gender-sensitive approach, and thereby to empower female workers and establish their rights. She's engaging with different entrepreneur communities to take forward the inclusive business agenda in Bangladesh. So welcome to the three of you. Let us start this panel discussion. Let's start with Farah. And I'd like to ask you to center us back on the importance of this work to women and girls. So why was the issue of affordability of sanitary products important in the Bangladesh context? And why was tax relief pursued? Farah?
Thank you, Susan. It's a pleasure to be in the panel of an important discussion related to the menstrual hygiene campaign and the product. To be very honest, after listening to what Laura mentioned about the link with affordability and how it can be linked with the tax and VAT campaign, I just sitting a little bit back. But I would like to focus on the Bangladesh situation, how it looks like, so that the audience here, I am sure that there are a multitude of audience from different countries, they know the situation in Bangladesh. So to talk a little bit background, if you see the average number of 58 million Bangladeshi menstruating women and girls, what we have in reality is that only 20% of them, have access to the hygiene products. So that means the rest 80% of, they are using the rags, which are from basically we know it's unhygienic, and and they don't have access to the safe water to clean and wash it properly and then dry it and also to store it hygienically. So all these, a lot of steps that is very important for women to manage menstruation is not, we are not able to ensure it. So where do we stand actually? And on the other hand, we have a situation where there's 1 in 5 or under the poverty line. That's the current situation in this country. So when we talk about managing menstruation for these for these women, always the first thing that comes is the taboo, or the mental, the cultural, the social barriers that limit limitation from accessing the products. But the discussion on affordability gets somehow into a different different table. Why I'm focusing here this point is that most of the NGOs we focus a lot of awareness. A lot is, and that is required. But when I showed you the picture about how use of cloth, about from the 80% women are not able to use it properly, then there comes question of what would it look like when we have a utopia that everyone knows how to manage the period effectively, hygienically, and then you have a product that costs around $1 or maximum $2, and that is not affordable to them. So where do we stand there? So that's a big question that we have to ask ourselves. So interestingly, the MHM strategy, which we are currently working in the MHM platform in the country, is focusing a lot on the discussion of affordability. So to be very honest, we don't think that there should be a clear research required at all to talk on this point of affordability, because that is very much clear picture as it is. If you are educated, your behavior changes, then where is the product? Who gives you that product at that cost? So that is on one side, and that's very, very important discussion. Now come to women. We all are women in the panel today. It would have been good to have a male also in the panel. So, so we as women, for us, it is a basic requirement, right? So women, there might be chances that there are people who are not able to give birth, but no women crosses the menstruation. So that itself says is a basic commodity, and that was never considered at all. So when we talk about from a basic commodity, forget women and men, but the basic human right, that also is a very important discussion for when we talk about affordability. So all these discussions around price and affordability, and it's linked with that, when the country was progressing, and there was lots of global campaign around, especially after the awareness of the Menstrual Hygiene Day and the campaigning by the WASH team and the global movements around what that inspired the local network, to talk about these issues. We know that there are this private sector. Laura was talking about the private sector. So the private sector, they have advocates, always talking with the government to reduce the taxes and everything. But this time, what happened? It is the inspiration on the work of these network, and you might have seen, since Susan was involved in the studies, you might have come across where the students were doing campaigning, there are social campaigning, there were articles in the newspaper. So all these together, there was a pressure created, and it was sensitized to come to this effort of VAT reduction. And that's how I would say I would set the scene for introducing this particular question. Thank you, Susan.
Thanks so much, Farah. So let's now shift a little bit to look a little bit more at the campaigns themselves. Kirsten, so we often hear a lot about the need to have a very strong economic rationale to back your advocacy campaign. It needs to be evidence-based. So since you were involved in this aspect of the work in South Africa, can you tell us a little bit about what that economic rationale looked like, and ultimately what motivated decision makers to act?
Yes, sure. Hello from Cape Town in South Africa. So with the work that the Budget Justice Coalition did that I was part of, we were responding to the VAT increase from 14% to 15% in 2018 in South Africa. And there was, as you mentioned, this backlash. And the backlash came because it was the first time in 25 years, in fact, since democracy in South Africa, that VAT had been increased. And many people felt this was a regressive tax decision, meaning that it would have a disproportionate impact on low-income households. And what we found when we started to look at literature was that actually VAT in South Africa is considered slightly progressive. And the reason for that is because there's zero rating of VAT products. So we started to advocate to government that we would like to see some additional items being zero rated. And then we did the Institute for Economic Justice, and I must acknowledge Linda Kukle and Josella's work on this, did a study where we looked at the suitability of a number of products. So we had 23 different products that we thought were well targeted. And I also worked on this with her. And we put them through different tests. So we wanted to see generally were they well targeted to ameliorate this impact of the VAT increase on low income households. And then we also had a health test and a gender related test. And so we got these products. They were, for example, a lot of them food products like cake flour, bread flour, and we also recommended sanitary pads, nappies, and baby formula, things like that. And then we went to Parliament with our submission, which we made to this tax expert panel. And we didn't really know what they were going to decide. They had to deliberate on this. And it was a nice surprise in your study, actually, for me, to find out how they made the decision. So I would encourage anyone listening who's a bit curious about the case studies and what you can learn from them. I learned something by participating and from reading the other case studies as well.
Fantastic. And for anybody who's interested, you can find this, my study as well as Laura's study on the periodtax.org website, which Ina will be launching in just a few minutes. So exciting news all around. So I'd like to ask each of you, maybe starting with Kirsten, we talked about the tax relief measures that government took. And I'd like to know a little bit more about what other results, or what did the results look like following the tax advocacy campaigns? Did they unlock universal access to sanitary products, or actually what did they achieve? What was important to you that they achieved? So Kirsten, could you start? And then Farah, and then Carol, please.
Great. For us in South Africa, what we saw was that the tax expert panel came back with an announcement to say that there would be zero rating on sanitary products, and then it ended up that it was only pads, not tampons. And they also zero rated white cake flour and bread flour. And so we'd been waiting. We didn't know, these 23 products, which of them would they choose? Would they refer to other research? How would they make the decision? It ended up they used the gender justice rationale to decide on this. And then they'd actually favored from the outset a spending side solution to mitigating the impact of the VAT increase. And so they did that as well. We saw later what came through was a budget allocation to a sanitary dignity project. And that program is something that other coalition members and other civil society organizations that were broadly aware of their work as well were advocating for. They wanted girls in schools to be able to get sanitary pads for free. So we were quite excited when that announcement happened.
Laura, could you add to that with your results?
Yeah. Yes. So I would start the message that, yes, joining hands with Laura, that if sanitary pads needs to be made affordable, we need to do more beyond VAT. So the removal of VAT on the import of raw materials has really not resulted in a price reduction. That is the first point, the result of all the campaign. So the point that manufacturers put is that there are other VAT and GSPs that the sales tax and everything, and that adds that gets compounded, and that is not possible to reduce the prices. And especially when you talk about the removal of the VAT on import materials, there are 12 to 14 raw materials that go to the production of a sanitary pad that are being imported. And this reduction is not same across all these materials. That ultimately, which means that it is not going in any favor of the price reduction. Now let's talk about the other side of it. Again, I'm quoting to Lara what she was just mentioning about the valued effect, and Susan also mentioned about the valued effect of it. So when you see the discussion around MHM, all the discussions or all the awareness was mostly done to the CSOs, NGOs, national and international NGOs. So the discussion about in the government level has not that means prioritized. That should be the right word I would use. We have good, beautiful policies. The health policy, the national gender policy, then we have recently the adolescent health strategy. So in all these, the MHM has not been prioritized to the extent it was required, despite this fact being it is a basic thing. So now with this tax campaign, we have reached the next level. That means reaching the government, triggering the effort to making that stimulus inside the government, that there should be enough attention from the government also. This is one thing. And the second thing is that now you talk about the campaign that has resulted in the VAT exemption, that now the activities like the MHM, the WASH network, they are so confident in pursuing things to the government. So even it is for 2 years, there could be more to be done. And one more important thing I need to highlight is that the 20% market is occupied by some of the manufacturers only. Even though we have a shift from the import of imported sanitary pads, and now we have a number of local manufacturers, they are not enough to capture the whole market. So if you have a scenario, we are already covering 50% of the menstruating population with the hygienic product, we need more manufacturers. So now with the NBR, the National Board Review has been touched, we have other other government bodies who are responsible for making the private sector environment feasible, business friendly. So those things are getting, there's a lot of hope that can be made possible to have these SMEs come up with solutions and manufacturing approach. So these are some of the hopes that is the result of the value added effects we see from the tax campaigning.
Yeah, so I really have to agree with Farah and Kirsten, because for a lot of this, it is like a time of hope, because what this tax advocacy has done, first of all, in Nigeria specifically, is increase conversation about affordability, because what we deal with a lot is a lot of stigma and hushed conversations about it, or hardly any public conversations about it. So one of the wins for this advocacy was the topic discussed in the Senate for a start, and also getting, another thing that we do struggle with is information and data. I mean, people have made reference to data, but we do struggle with data because of how populated we are. So this is giving more zeroing in on data, on trying to find out the exact number of the population dealing with this issue, on getting them pads. It's also made the government specifically come out and say, we are not taxing locally made products. However, it's a dynamic thing, because in our community, we rely heavily on imports, and Farah mentioned not enough manufacturers locally. So it's been amazing that we are getting to that point where when you list the things that are important, or when you list topics to talk about, you're talking about menstrual hygiene, and you're talking about the education of menstrual hygiene, and that you're focusing on the data, on gathering the data. It's also led to a lot of advocacy and new advocacy groups starting up and getting involved in which is reaching really low income communities that don't have visibility. So visibility has been really huge for us as a win in this. Something that specifically happened, I must say, was during the COVID relief materials. There were some governors who put sanitary pads in the COVID relief materials. It's almost, I would say, unprecedented. It's not something that has been at the forefront of our minds as a necessary. So while I won't go into the challenges, I feel like these are the major wins that we have had. We've had a lot of increased, again, it's just always important to talk about how, while tax advocacy is not the total answer, because of how widespread it is, it's led for us to be able to include a lot of other conversation into menstrual hygiene, into even putting menstrual hygiene management as part of education for young girls. So what we are focused on is what's the end game, and is this a step forward? And to be very honest, this advocacy has been a step forward in involving other organizations, in bringing it to the forefront of what's in the mind of the government, and in generally progressing this conversation. It's also led to finding out other how would I say, other like activities that we can be a part of. So seeing what is happening with WASH and what is happening with like WASH facilities in sanitation and all of that, all these conversations are being able to be brought as one, and all these advocacies being able to be brought as something that we can all do together and not leave any part of women's reproductive rights, behind. So visibility is huge, and I keep going back to visibility because it's one of the things that has brought us here into this conversation today. This wouldn't have happened, say, 5 years ago, So it's this forward activities is also leading to more for organizations, and that's really helped because on a global scale, I remember that when we started, specifically, we had to explain, we thought it was important to have the conversation. Now we're not having to do that as much anymore because now people know, and you get to sit at the table to then begin to lay your complaints or to lay your advocacy, and it's being done in such a widespread, in a lot of countries right now, that it's easy to relate and draw information from what this other country has done, what the UN has done, what someone in the UK has done, and all of that. So there's now more access to information, a little more access to data, a little more access to funding, and just widespread recognition for this specific activity. And that for me is a win. It's not everything, but it's a start. Thank you.
Caro, Farah, Kirsten, thank you so much. Caro, I really like how you framed this as like a moment of hope for this work because there has been so much progress, yet still more to do. So Caro, I wonder if you could tell us a little bit about what are some of the outstanding challenges that you see in Nigeria for making sanitary products affordable and beyond?
Well, so I think one of the things is not for us to move from the conversation about, not move, but kind of be inclusive in our conversation and not just sticking to just tax advocacy, to bring it to, do we need more local manufacturers? Do we need more sustainable options? Because a lot of us have gone from disposable pads to reusable pads. And because that's not really acceptable, it takes a lot of sensitization. So those are like the challenges are education, because even for people who can afford, they do not know the right things to use. So again, there's people that can't afford at all. So affordability and implementing that, but there's also education and people knowing the right steps to take. There's also us thinking about, and I say this every time that I talk about women's issues or things affecting women, how it's so important to have more representation of women in government. And I say this because a lot of times women are better at advocating for women. So in somewhere like Nigeria, where representation in government for women is 6%, you would always fight 10 times more to get any of these issues to the forefront or to implement any of these things, because they don't even want to have the conversations in the first place. So we've had implementation issues into proving why this is real, and even when something goes into law, for example, like how we have said now that there's no tax on locally made products, it is on paper, but then again, there's inflation. So even if you're saying you are not taxing it and this product was $1.60 and now it's $1.80, it doesn't matter if you take 10% off, you are still back at the exact same price, but still having that issue of affordability. So that lack of representation, bureaucracy, implementation, lack of sustainable activities beyond tax advocacy. So these are like the things that we have to deal with one after the other. These are the things that we're currently dealing with in our own communities. And obviously for nonprofits that do a lot of this work, there's the issue of funding for those nonprofits, because they are giving out these products for free and they are buying both internationally and locally heavily products. So in the end, tax affects the manufacturers, then we're bearing the cost. So all these things are things that cannot be ignored in this trying to advocate for more accessible period products in Nigeria.
Thanks, Carol. So clearly the situation is complex, multi-layered, multi-sectoral. I mean, there's a lot of things to do on the to-do list to be able to address affordability of sanitary products and in your countries and my country and beyond. But what would you say, and I guess this is our final question, and I would like to hear if there are maybe your top 2, top 3 things that you really think would move the dial on affordability of sanitary products. What would you recommend?
On my side, one of the things that I'm quite alert to is that you can actually have reversals. So it's a nice announcement when you get the announcement of the VAT zero rating or the sanitary dignity program, but funding inevitably becomes an issue. And when your country's budget is under huge pressure, you actually have to watch what spending is being allocated there so that next year it's not that that program is now gone. So I think that is something to just for activists to keep their eye on, to say, you know, is the budget allocation still there? And then also, I mean, data really helps in making the case. And so some of the organizations that work in the Budget Justice Coalition actually go and try to collect price data. It's quite a lot of work to do the sort of primary data collection work, but it's quite important in building your case.
Okay, it's me, right? Yes, Susan. So yeah, if you ask me from the point of view of the campaigning of VAT and tax, then I will say that we, whichever country is doing that advocacy, they need to understand the tax systems in that particular country, as we know that it's very complicated from one country to another country. And even if you are in the same region, it's totally different. Even if you talk about India and Bangladesh, we are very close, but still we have different systems also. So we need to, it's not only about the policymakers, the campaigners also, they fully don't know what is actually about the tax system. So a good knowledge about tax systems has to be there, and then only the sensitization can happen. But I want to keep some different compelling points, because we are talking about affordability, and we also have argumented that tax is not going to solve that problem. From that point, I have some recommendations to make that you can take it from the experiences we have. On the first thing is that there is always a population for whom the products has to be made free, the hardcore poor. So there we can't talk about the price reduction and cost sharing and everything. So interestingly, the government here has taken some steps from the health ministry to have some free products in the union levels. And that's a very small move, but it is good, appreciable. The second thing is that when we talk about affordability, it is like, you know, it's a very abstract thing. What is affordable for a woman working in a factory earning, and it's not the same for the woman who is in a rural area and who doesn't have any income at all. So that let us not talk from that point. So we need to have some structures of not just talking about what is affordable, but also how it can be cost shared. Let me talk about the experience in the garment sector. It's the same square who has a great monopoly in the private sector for sanitary pad. They have come up with some product named Femina after our intervention with them in the garment sector, and that product is, you know, it's just half the price of the local other products. So it's half the dollar. So still women are not buying it. So affordability is not the question. Then we started to do, it's a cost sharing mechanism, like the workers are paying half, the factories are paying half. So that's how the adoption is making it happen. So the price is not if you really want to work on the price, we should not talk about only about the affordability point of view, how we can make such mechanisms of cost sharing happen. Maybe in the industry level or the institutional level, there can be cost sharing mechanism. And very importantly, for a short-term strategy, these private sector need to innovate and make some inclusiveness, not just capture the big the high income groups. Also come up with, like the Square has come up with the new product for the garment workers. So there should be more private sector coming up with that. And the last thing is a long-term solution. These days we have in our country new small SMEs coming up with reusable pads, and that is really appreciable. But the point I made in my beginning of the speech is that you have to ensure at every stage that this is hygienically cleaned, washed, dried, and stored. So from that point, we have a long way to go. So that should be a long strategy that is addressed so that these can be also promoted. And from that point, I believe that that can be made more affordable, or I would say less price. Thank you.
I have to agree again with everything that's been said, because it's so important when we're having these conversations about affordability to understand our audience. You know, so I keep going back to low-income schoolgirls and people in IDP camps and all of that. It's so important for, I would say, the government to fund more research surrounding this work and also prioritize the communities that we are focusing on. So affordability is different across different classes of women. And even if we are going to make products for low-income women, we have to be sure that these products that are made for low-income women we're not sacrificing quality because of quantity. So it's so important to focus on ways in which we can fund this without taking away the dignity of the people who we are trying to support with our activities. And one of the ways is actually listening to them and seeing what having these communities being represented in these conversations. It's also important that I believe for tampons and pads, the more we have this conversation, it's so important that we continue to advocate for them to stop being classed as luxury goods, because a lot of countries still do class them as luxury goods. And while in Nigeria they're classed as essential, when you have these conversations, you find that people have expect women who can't afford it to just do without it. So we need to normalize it enough for this to be part of soap, to be part of what is in the public bathrooms, to be part of what's, in fact, where there's like peer education about menstrual hygiene, and put that you don't, I mean, the periods don't check your bank balance or your account balance before coming every month. So we need to make it normal that periods don't stop for pandemics, periods don't stop when you're poor, periods don't stop when you don't have money in your account, periods are going to come every month. And as a result, it needs to be part of a global conversation that these are a necessity, they're not a luxury, and whatever options we are coming with can serve both the poor people and the rich people. And it also comes back to the economics, who is going to pay for it? Most of this is going to be done between the government and the private sector. And when it comes to the private sector, if it's profitable for them, they're going to do more. If you make laws that make it easy for them to do business, they're going to do more business. So my recommendation is always that let's put more money into this research. Let's put more money into these products. Let's put more money into finding out what the experts are saying. And when we do that, we'll be getting very amazing quality of information on to take. And let's listen to the people who are using this product. So yes, I love that. It's always like when it comes to these things, it's women who are at the forefront of this, but also experience this, so know where the shoes pinch. So it would always be education, affordability, and funding of more research, so that we have adequate information to work with. We know the communities that need to be impacted immediately. We know the ones that we can put for the next quarter, and going into every year. Kirsten said we should be watching the budget, that what they have allocated has not reduced, because it does happen, and inflation is happening, and as the money is going, the inflation is happening like that, and the money is coming down like this. So that means we have even less purchasing power going into the next year. So it's a work for all of us, and I mean we all just need to do our part while making our recommendations and our submissions. So that's what I have to say. Thank you.
Susan, can I have a minute? Sorry, can I have a minute? There is some good news I just wanted to share. Today we had an event on the project, and I met the people from the industry and the sanitary pad industry. So what I heard is that usually there is an increase of prices on the sanitary pad every year because there are other costs linked to the production. So this time, after the VAT has been exempted, they are not increasing the prices. That's the good news.
amazing.
Fantastic. It's great news to end on. Thank you so much. And obviously we can talk to you all day because I just want to say thank you for the richness of your experiences, of your passion, of your continued work in this area. And I would encourage anybody who's listening that has any questions for the panelists, please drop them in the questions box because we're going to be having a question and answer period shortly. So thanks to all of you, and we will hand back for some exciting news from WASH United.
Thank you.
Thank you, Sue, and thank you, the panelists. This is Ina from WASH United calling, and yeah, it's really, really inspiring what we just heard. And I'm based in Germany, and some of you might know that Germany also reduced the taxes early this year. And the good news is that in Germany the prices have dropped based on that. We've done our research, and it was never about affordability. It was more about being fairly taxed and gender equality. I just want to throw in that perspective, and then it's for all women and girls and not only for low income. So, but yeah, my main reason to be here is with today's webinar, I'm really excited to announce the launch of the periodtax.org website. And it's the first global site on everything around menstrual product taxation. I use screenshots now because I don't want to show you, but I want to encourage you to visit after this webinar the site and dive deep into what the sites offer, because there's a wealth of information that we compiled. It's the end of a 2-year project that is funded under the Innovation Fund by the Reproductive Health Supply Coalition. And it's also been a progress, because when we started, it was really all about, yeah, let's do a big campaign, and it's all about affordability and access. And through learnings from Tanzania, and some of the Tanzanian folks are also here today, we actually learned that it's not straightforward. So the work that you heard before, and that what we've done was actually happening very much in parallel and informed each other. And it's very much similar what we find here. So let me show what you all can find, and I hope you find it as exciting as we do. So we built a database and map for taxation for all UN level countries. So here are the countries that zero rate tax or tax exempt products, and these are in total 23 countries, including the UK, which is now applying this from this year or 2021 onwards. So we included UK already. There are 13 countries that apply a reduced rate, because in the European context, they're bound to the minimum tax rates. And we've built that, so we built an exciting interactive map where you can click on your country and see what is the tax rate, or you can click on any country to see what is the tax rate there. Is it a standard rate? Is it a reduced rate? Or is it a zero rate? So that's pretty a nice feature. And the next feature is a database. We build a database with for every UN country on what is the standard rate, what is the tax rate on menstrual hygiene products, are they taxed a reduced rate or a zero rate, when has the tax change happened, and more information and the links. And interestingly, and that also came out with a pre-discussion with the RHSC, we dive deeper into what products actually fall under the tax changes. And there's a big difference, as already Kirsten was saying. Tampons are not included in South Africa. In UK, and we saw from the chat box, for example, period panties are not included here. So in Italy, only sustainable menstrual products are tax reduced. So there's a big difference. between that, and also you can find this information on our website. Included in the database are links to ongoing or successful campaigns with the different information, so that you can see if there's a campaign in your country that you can join. I think that's really important, and there's been a call also from Caro, like coordinate and work together on making the campaign happen. And there's also a lot of learning, and I pulled out UK and USA. So for example, USA has a lot of state level campaigns that you can visit. And also, and here's a picture of mine, and some of you know me, next to David Rule, who is our tax expert that we consulted. We created free explanatory videos to help you without reading lots of documents. So there's a video around campaign advice, on how to, top tips on campaigning. There's also a video that explains what also Laura has told before, what are the flag factors that influences if a price is reduced or not. And because taxation is very, very complicated, we've created a video to explain everything around period taxes. For example, you heard now there's zero rating and tax exempt. What is this? Watch this video, the third one, and then you will learn the differences that are around there and how they actually influence the final price of the product. So easy and fun explanatory videos. Moreover, there are two guides that provide a wealth of knowledge. First is an advocacy guide for all the activists out there. It includes case studies, it includes examples from campaigns, how they mobilize the media, great creative examples, and different aspects, and how to develop a strategy around it. So that's a really great guide. And we've also done a research, and that is very, very similar and parallel, to what Laura and Hannah did, more of the foundational work, and Hannah and Laura expanded it with their models and to do this. So we looked at what impact does the VAT removal on the final price of a menstrual product has. And as I said, for example, in Germany, we tracked the prices ourselves, and there we saw also good impact. Included on the website are case studies, campaign examples, a lot of reference, a list how to address counter arguments, the most common, and a glossary of terms. And yeah, it's been, I really want to thank with that also everyone who's been involved, be it from our creative director, my colleague who did a lot of text work, people with the database, the RGC community who have provided some early feedback. And yeah, we're launching it now. And if you have more info or sharing updates or any comments on this, please contact me under this address. And yeah, happy browsing, I would say. Please enjoy this excellent brand new resource for you to learn more. Thank you so much.
Thank you, Ina. That was really great. That was really great information, and I'm sure all of the attendees would have a great time just going through all of the materials and understanding. I saw in the questions box some requests for advice on advocacy on period tax. So I think these are great resources that you can go to and take a look and understand better how to shape your period tax campaigns or join other campaigns in your region. So I believe we do have a little bit of time left for Q&A. So let's take a couple of questions for our speakers. And the first question is something that Laura, maybe you and Hannah can provide some additional input on. This is saying despite reduction or exemption of taxes on raw exported materials, or raw materials, market price of sanitary products remains the same and does not reduce. Is that possible? I think you said the answer to that was yes, but it would be great if you can elaborate on that a little bit.
So is this related to Bangladesh, I'm assuming?
Yes, yes.
So I mean, I think the big problem is that we don't necessarily have data to support that. We can sort of anecdotally from what we read in the newspapers say that there has been no impact on the prices of locally manufactured products. But I think the big point to make here is the fact that we really need data to be able to substantiate a lot of these claims and to support what we know from the popular literature and from anecdotal cases. But on an empirical level, we can't make that claim as yet. Hannah, do you want to follow up on that?
Yes, hello everybody. Yeah, it's data is one issue, but also in Bangladesh, if you remember that graph that that showed the complexity of the price and the complexity of the tax, the amount of tax that was removed by this import tax removal is just so tiny that, and given all the other margins that are there in the price, like the huge retail margin, the impact of removal just that one tax component is going to be very small. And also the industry, of course, doesn't have a motivation to reduce prices. They already have customers that got reduced to certain level of prices. Now government removes some part of the tax, so the companies just increase their profit. But we have heard we have seen in Bangladesh that particular company that got this tax break at the same time also introduced a cheaper product. So maybe there's some way to sort of try to provide something in return, but not by a lower price of that particular of one particular product. Yeah, thank you.
Thank you. Thanks, both Laura, Hannah. I think that gives some explanation for why this might happen. And I think there's also a need to also understand the local tax structures, local market structures to really understand when taxes might actually reduce. So there was also a question on saying that is it possible that tax reduction policies are simply populist measures and not really doing much in terms of changing the status quo, either for gender justice or for reduction in prices. And we actually saw that in India, that initially the Ministry of Finance actually came out and gave a nice, very logical explanation of why the prices should not, or the tax should not be reduced, but eventually gave in close to the election. So yeah, I guess maybe there's a better need to just understand your local regional structures, tax structures, and how they may change as well. Another question is on the issue of informed choice. And this is coming from a few different participants saying that wouldn't gender justice campaigns for menstrual equity also focus on affordability or increased access to reusable products? And in that same thread, shouldn't tax campaigns look at maybe making reusable products more affordable vis-a-vis disposables? And Farah, since you touched upon this during the panel discussion, would you like to maybe elaborate on that perspective?
Can you just specify the question again?
Yeah, so menstrual equity campaigns, shouldn't they look at reusable products and making them more affordable vis-a-vis disposables in terms of just the objective of gender justice and menstrual equity?
I totally agree with that. That's not I placed as one of the recommendation in my speech that there are, in Bangladesh at least, we have reusable products, but the issue is that the women they are using, they were not able to use it properly because of their access to water and the taboo that they can't dry in the sunlight and everything, and also store it properly. So because of this, it's still a challenge. So on one hand, it is a gender equity thing. On the other hand, it's also we need to ensure that the women can manage the period safely and hygienically. From that point, I would say that that should be, we need to work on that, but it's a long way to go.
Absolutely. I agree with you. I think just even the acceptance of reusable products at the policy level is a battle in itself. There's a lot related to creating evidence of safety, where disposables, you don't really need that evidence since they're already in the market and all of that.
But Tanya,
yeah.
sorry. But Tanya, the thing is that the current MHM strategy, which the MHM network and the government is involved in doing, is that we are addressing all these points. So how to take these issues also on the reusable thing. So it is there. But I'm talking from the more practical point of view, that there is a long way to go, you know?
Absolutely. Sure. Point taken. Last question, I think.
Tanya, just to just add, as I said, in Italy, they only made tax exemption on like sustainable and reusable products in order to really incentivize those types of products. That could also be an option, even if then eventually the price effect is low. But I think it sent a signal to the market.
Absolutely, absolutely. All right. We can take maybe one or two more questions. This is from Nancy. Has there been any progress as a result of all of this excellent work, where governments are considering collecting DHS data, for example, related to use of improved menstrual health products as a measure of gender equity? Anyone who feels like they are best suited to respond, please take the floor.
This is Kristen. I can respond on the data issues because I used to manage a data technical working group, and then part of that work was working with statisticians, and there's a group of statisticians that are part of the data effort at the UN that we also connected with. And so sometimes you have to make statisticians aware that they need to adapt their statistical tools because they're not collecting something because they just didn't actually realize to collect it. So I think that kind of data advocacy is also quite important. Otherwise, the task falls to academics in university research units to try and collect data, or to advocacy organizations, and that data may not be considered official data. So I think statisticians are an important group of stakeholders to also advocate to.
Absolutely. Thanks for that, Kirsten. And I think even from our experience in India, for National Family Health Survey, started tracking access to improved menstrual health products in the last round. And it's considered a great win. But again, it's also limited to disposable sanitary pads as an option. So I think there's a long way to go, as Farha really elaborated. The last question we can take is, has there been any assessment in Tanzania at all, considering that they rescinded the tax reduction policy, and any lessons from there?
Hi, yes, maybe I can answer. So I don't know if Halima is still on the board. So we did a case study with the main actors in Tanzania, and you can find this on the website. And there also Halima has done some, and internally they've done some really good assessment why this didn't happen. This is 2 years ago. I think on this really, like when this tax was removed, it really shocked everyone, and also stopped a little bit the momentum in the region. However, I think this learning from Tanzania was so critical, and one of the key learnings was you need to have accountability. You can't stop after the tax was removed. You really need to continue advocating for it, and secondly, also really understand the local market. I think that is what Laura also presented there. On a good note, Tanzania has included tax incentives for new local and innovative companies producing menstrual products. So they try to mitigate a little bit the issue from that front. However, I think for now, unfortunately, Tanzania is a little bit burned territory in terms of taxes, but I know that lots of actors are working on other aspects of increasing access and affordability in Tanzania.
Great, thanks, Ina. Thanks. I don't think we have many more questions. One suggestion is maybe we can, there are a lot of great insights on local level advocacy coming in the questions box. So maybe we can compile those as part of the report that goes out after the webinar. Since the chat box is not really visible to everyone, and sorry to everyone for that. So maybe that's something that we can do. Lastly, Ina, please, I would request you to close the webinar. It's been excellent in terms of insights and learning. I personally have learned a lot. Please share your closing remarks.
Yeah, thank you. And thanks for everyone to stay with us. So I think I wanted to provide a small summary, and it's been the key takeaways, I think, have come out very, very strongly. To begin with, the removal or reduction of taxes on menstrual product, if they ultimately result in also reduced product price, is really highly dependent, and it's not necessarily inevitable. We learned a few of the aspects like country tax system, the market, but also the overall price index of a campaign. So while removing or reducing taxes could result in increased affordability and access, it is certainly not a silver bullet. I think that came out clearly. But I would like to stress again that in many countries, some of them the examples we heard, but also others, tax campaigning are really about the fairness of taxation and recognizing menstrual product as an item of basic necessity for all women, not only low income. And therefore I love really what Caro said, that the advocacy led to the inclusion of menstrual products into the basket of essential items during the COVID-19 crisis. And I know India has been the same. And last but not least, what came out very clearly in today's webinar is that all tax campaigns have triggered much broader societal conversations about stigma, period poverty, and gender equality. And I believe that persisting period stigma is the root cause that results in continued neglect of the issue, including unfair taxation of menstrual products. So the fact that tax campaigns are an effective way to address broader period stigma is really important. So, and as the point, I think, so the call to action. So really be sure what your campaign goal is. If your campaign goal is improving access, make sure you do your proper research and of your country's tax system, and make a decision if really taxation is a way to go forward. And I recommend a professional tax expert. If your primary goal is to promote fairness and gender equality in taxation overall, like such as in South Africa, I think it's absolutely valuable to go for it. And if your primary campaign goal is about addressing wider period stigma, also period taxes is very effective. So my second call to action is really use the period tax resources and that I just presented. There's a wealth of us. We're looking resources to help us to keep updating it. But please keep sharing your insight with us. And in case there are participants who are not Menstrual Hygiene Day partners, please join the MH Day movement to catalyze action and awareness on menstrual hygiene. And I really want to thank everyone to share their insights today. We're building upon that, and we keep on updating the website. And I hope you all join us in the fight to end period poverty by 2030. Thank you very much.
Thank you, Ina. Thank you, everyone. And we'll be happy to share the recordings along with the reports that were presented during the webinar today as a follow-up. Thank you.
Thank you, everybody.